So we know that the pandemic really exposed a lot of inequities, a lot of health inequities in our communities over the past couple of years, right? We know that there's asthma, food insecurity, so many things that our community is struggling with right now. I'm wondering, as the representative, what are going to be your key priorities for healthcare for our communities and making our communities a healthier place?
Yeah, so I think in terms of the public health outcomes within our community, right, a lot of it has to do with the air quality problems that we have, right? Because we have the Tobin Bridge where 60,000 cars are going over it every day. You have planes flying overhead. You have ships going down the Chelsea Creek, right? So there's just a lot of pollution being produced in our city, which contributes to the higher rates of asthma that you mentioned, right? The more cardiovascular problems, which I know a lot of people are struggling with. So I want to make sure that we are doing everything that we can to clean our air, so that when people are outside, they're actually breathing cleaner air. We can do that by making sure that people have can actually buy electric vehicles, which produce less emissions. We can make sure also thinking about the air inside the house, right? We can make sure that we are retrofitting homes, making sure that people can actually buy better air filters. We can actually use state money to just give people these things that they need.
Another thing that people have a lot of concerns about in our communities is just how expensive healthcare is. People are avoiding the hospitals. They're not getting the treatment that they need because they simply cannot afford to, right? So what are we going to do to make healthcare a little bit more accessible and more affordable for our community members?
Copays, deductibles, they're just going up and up every year, and it's just becoming increasingly impossible to actually have coverage for the things that you need, even with insurance, right? So I think what we need to do is make sure that we are moving to a system that just has no copays, has no deductibles, where the decisions about what you need are not made by your insurance company, but by you and your doctor, right? That's a decision that, right now you have to call your insurance company and ask them, hey, my doctor said that I need this. Yeah. And then if the insurance company says, no, you don't, who are they to be making that decision for you? In terms of that, I'm committed to working with other legislators who have been pushing for a stronger public option within the legislature, continuing to advocate to make sure that, at the federal level, we actually get a system that, a Medicare for all that's actually doing everything that we can to negotiate better prescription drug prices for people, to make sure that it's actually accessible to people. And then we also have to think about what we talked about earlier, right? The social determinants of health, to make sure that we are keeping people healthier so that they don't reach a time when they need to have these big procedures because of the long-term impact of low air quality and the long-term impact of just living in a city that where the health of our people is at risk every day because of what's happening around us.
Thank you, Roberto, and thank you for naming all of those things, right? As you said, it's really important to address the social determinants of health, the places that people eat, work, live, play. How do we make the environment better for people so that they live longer, healthier, and happier lives? So I'm really excited that you're running, and I can't wait for you to make all those changes at the state level.
Thank you so much.